To mark Childhood Cancer Awareness Month, we are having a question and answer session on childhood cancer. I'd like to introduce you to my panel. This is Porrick. He works with the financial and practical support team. Alex works with the psychosocial team. And Elaine is our children's cancer coordinator and also a children's cancer nurse. I am Amy Nolan and I am the head of children, adolescents and young adults within the Irish Cancer Society. So there's approximately 190 children diagnosed with cancer every year in Ireland. And Elaine, maybe you could tell us what are the most common types of cancer that you would encounter?
Okay, so the most common types of childhood cancer in Ireland are leukemia and brain tumours and tumours of the central nervous system. However, there are lots of other childhood cancers that you'll hear about, and they're different than adult cancers. They behave differently, they appear in different parts of the body, and they also have different names as well. So it's not good to compare like with like. They're very, very different.
Okay, and is a diagnosis, when a child is diagnosed with cancer, where do they receive their treatment?
Okay, so if you have a childhood cancer diagnosis, the diagnosis will be confirmed and the treatment planned in the National Children's Cancer Service, which is in CHI at Crumlin. Okay. Now, there is an exception to this, and this is neurosurgery happens in Temple Street Hospital. Yeah. But all of your treatment will be, as I said, diagnosed, confirmed and treatment planned in Crumlin. And this will be supported by a shared care centre. There are 16 shared care centres throughout Ireland. And
what is a shared care centre, Elaine?
So shared care means that they share care with Crumlin.
Okay.
The care is directed from Crumlin and it is delivered in a centre close to where you live. Okay. And it just means that you don't have to go back to Crumlin all the time.
That's really nice, and I'm sure it's quite reassuring for patients and families as well if they don't have to make long distance trips as well.
Yeah, and it's really good. They would have it's good for them from, say, they would have really good relationships with the people in their locality, and they would have their treatment locally, and they wouldn't have the pressure of having to travel all the time, which would reduce financial pressure as well as just even time and just the thought of having to go up to Dublin all the time for your treatment. And it works really well.
Yeah, I can imagine. How long do these treatments usually take?
So depending on what type of treatment you're going to have for cancer. So there's different types, and I'll just touch on all of them very briefly. So there's obviously chemotherapy, radiotherapy, surgery, bone marrow transplant and immunotherapy. And it could be anything from, if it was surgery only, you would just have the surgery and then it would be all over, or it could be anything up to 3 years. So say the likes of some of the leukemias, the boys would be treated up for 3 years. Okay. So it can be a long time.
It is a long time, yes, absolutely. And this is a really difficult question to ask, Elaine, but what are the chances of surviving a childhood cancer?
Well, at the moment in Ireland, approximately 80% of all children with cancer will survive. Now, that does vary, however. So you've got some children and it could be their survival rate would be in the 90s, and that would be something like leukemia. And then on the other hand, there are some that are much lower as well. So it all depends on the diagnosis and the treatments that they receive.
And for any family, it must be such a devastating situation when their child is diagnosed with cancer, and I can only imagine the shock that they experience. Could you tell us a little bit about that, Elaine, from your experience as a cancer nurse?
Well, I suppose the way I would look at it always is that, when families get a childhood cancer diagnosis, they enter into a world that they have no idea exists. It is, fraught with, fear and anxiety and stress. And, apart from the diagnosis alone, which is just so horrific, They have to come to terms with meeting loads of new people, a new language, an understanding of drugs that they may never have heard of before, an expectation that they will be able to manage some technical stuff that, say, like taking care of a Hickman line or an NG tube. So it is really, really overwhelming. And that isn't even taken into consideration, trying to run a house, manage siblings, perhaps take care of a job as well. So it is a very difficult time for families.
Yeah, absolutely. And maybe Alex, from your perspective and psychosocial supports, this diagnosis, can you tell us what that impact looks like for children and for the families?
Yeah, absolutely. I mean, I think as Elaine said, it's a massive shock, and you're entering into a whole new reality, really, and a new world. And with that comes such a myriad of emotions. Each member of the family, even more so the child who's diagnosed, is going through things, different emotions at different times. So there is feelings of incredible shock, of disbelief, of anger, of fear, of uncertainty, the pressures coming from all the practical elements of your life, but just, in yourself, how you're feeling, as a parent trying to protect your children and your family unit, and then as a child trying to get your head around it. So absolutely, there's extreme shock and fear. And I think, the best place to start really is to stay close to your medical team in your unit at the beginning, to reach out to your in-hospital psychologist, to lean on them to guide you around those initial phases, and then to sort of move through it in a very to create for your family and your child as open an environment as you can, so that everybody is allowed to feel what they're feeling. I mean, in terms of supports, obviously, so your hospital will be your first port of call. And then as you move back out into the community, it's about sitting back and understanding what supports you have around you, of which there are many.
Great. It's really good to hear that, Alex. And I think it's nice to hear that you allow for those feelings that are happening. Absolutely. That it's okay to have those feelings.
Absolutely.
And acknowledge them.
And okay to know that you don't necessarily know what to do or what the right thing to do is. So it's all, a learning curve. And it is to sort of lean on those around you as best you can.
Yeah.
Even friends and family, your extended network.
Absolutely. Elaine, it's a really difficult time when your child is having treatment in hospital, but there is some sense of security while you're there. There's a medical team, there's always somebody to ask a question if you need to ask a question. So I imagine the time around discharge can be very daunting. And what advice would you have for those families and children on discharge?
Well, discharge is it's a funny one, because people desperately want to get home. They're laser focused on that. They really want to get out of the hospital. However, there is equal measure of delight and dread, because once they're going home, the responsibility, as you said, shifts to them, and they can get very scared about what lies ahead. There will be a lot of education before you go home, and that will be with your maybe your nurse specialist, the ward nurses, pharmacist, dietitian, and there is an expectation that you will be taking care of your child at home at a level that you wouldn't have done before. So that is very tricky. However, please trust that you won't be going home unless it's safe to do so. Safe for the child and safe for you. And that the first time home is always the hardest, because everything is a first. First time giving drugs, first time looking out for side effects, first time taking temperatures. And you will get into a rhythm and it will get easier. There are a few things that I would recommend that you have close to hand to make it a little bit easier. And that would be your contact details and contact numbers, people to contact in different scenarios, like say your emergency details, have those close to hand, or just the person that you want to contact from a questions and answers point of view. Okay. He's a bit off his food, what'll I do? Or, those sort of level. Yeah. The last point I'll just mention to remember is, before you go home, before you leave the hospital, always make sure that you have your prescription and that you have your next appointment. And whether that be going for your next blood test or returning for your next chemotherapy, It's really important to have those at hand because they frame your time at home.
Yeah, absolutely.
And also, always remember that there's support there and it's only a phone call away.
Yeah.
So you can either contact your medical team, or there's also support available in the Irish Cancer Society through the support line. And if you would like to talk to a parent who's been through something similar to you, there's the parent peer support available, and that's available to be contacted through the Irish Cancer or through the support line as well.
Okay, perfect. Now, Pork, while you might meet the social worker during your time in hospital, I think it's really when a patient is discharged home, they begin to realise the financial impact. Maybe a parent might have to give up work. There are childcare issues and a lot of elements like that that wouldn't have been considered before. Does the Irish Cancer Society have support or financial guidance around this area, Pork?
Sure, Amy. Obviously, those thoughts probably, when you're alone at home thinking about these things, that's when panic sets in.
Yeah.
What I would say is the panic, while is natural, there are supports. There are supports in the form of state assistance and entitlements. There are quite a few of them, and people should become aware of them. And the Irish Cancer Society has established a service which is about signposting people to those various entitlements and other services that might be of importance when you've had a cancer diagnosis in the family. So we have now a team of practical financial support officers.
Great.
Whom you can call and contact either through our Daffodil Centres, support line, or online.
Okay.
And they will work with you to look at what you may be entitled to. We would always advocate that people be familiar with the Citizens Information website, and we will signpost particular benefits that will be available on that. We'd also look at other benefits outside of that, for example, the child grant, which is available to all families who have had a diagnosis with a child. But there are other agencies that can also support, and that can take the pressure off. So practical issues like transport, for example,
Yes.
we would have to try and direct people towards assistance in that area. And within the actual society, we have a volunteer driver system, which is also expanding now for children with cancer, and also a Care to Drive grant, which is available to all families as well.
It's really good to hear that.
Service,
Yeah, Pork. And I think the distressing piece is around trying to navigate your way around that when you're trying to navigate the new language, as you said, Elaine, of chemotherapy, radiotherapy, medications. So to think that there's somebody that you can call to help navigate that, I think that's really important.
Our staff are trained, they'll understand the cancer environment, and they'll be sympathetic to the needs of the family. And we can't obviously guarantee anything in terms of entitlements, but we can certainly signpost people to those entitlements.
Great. And the Children's Cancer Fund, my understanding is it's a grant of €3,000 and it's not means tested, Pork, is that right?
That's correct. So every child diagnosed and on treatment for cancer is entitled to that grant.
That's a great help, especially in the current
and there are other
cost of
grants
living crisis.
that families can be directed towards as well, which can be an assistance at this time.
Brilliant. Thank you, Pork. And Alex, are there psychological supports that the Irish Cancer Society provides for families going through this really difficult time?
Absolutely, Amy, there are. I think as a starting point, as sort of the first step, there's a lot of sort of what we would call psychoeducation tools that the Irish Cancer Society has developed, and they're all available on our website. And basically these are literature, seminars, workshops, basically that you can just access to on how to manage your emotions, how to acknowledge what you're feeling at this time, understanding the myriad of emotions that are coming up, what could be coming up at the stages of it. So I think that's a really good starting place. Then as you move forward, we offer ourselves directly remote counselling, both for parents and, in this case, more importantly, for children going through a cancer diagnosis. So we have one-to-one counselling, and we have, in particular, also some play and art therapy available as well. Moving out from that, so that's ourselves in the society that families can access. And then moving out with that, if we want to look at a more regional breakdown across the country, as we spoke of earlier, people are in their local regions and they're working with their local support centres. So we are partnered with a series of cancer support centres throughout the country with a very good split. And they have in-house, in-person play therapists, art therapists, teams who work specifically with children going through a diagnosis. So that's an excellent approach in order to help these children work through the shock, these new feelings, the uncertainty, the fear, just everything's changed for them.
Yes.
Play therapy is excellent for that. It explains the process in a very accessible way to them. So there's what we offer internally in the ICS and then through our network of centres. Then there is obviously, if we take a step further out, there's some larger organisations within the country, that offer sort of support to parents and to children. So we have the Childhood Cancer Ireland, we have Canteen, we have Hand in Hand, we have Barrettstown. So there is a lot of great organisations out there that can help, absolutely.
That's really good to hear that, Alex. And is there a time where you would recommend that somebody should contact the Irish Cancer Society for these supports? Or if they have contacted the Irish Cancer Society previously, is it okay to come back, at a later stage, or if there's a change in diagnosis or plan or treatment?
Absolutely. I think it's such an individualised journey for everybody, for the children in particular and for their families. What I would say is it's a great thing to arm up with information. So it's wonderful to move as quickly as is possible, given what people are going through, to get as much information on board. When you have that information, then you know what's available to you. And once you know what's available to you, then it's your choice when you feel ready to move forward with that for your child, for your family, for other siblings. And that's a personal choice. People move in and out of requirements for therapy. They might really need an sort of immediate intervention at the beginning. They might do better in the middle part of a treatment plan, and they may need to come back at the end. Other people might, just sort of find a lot of inner strength and resilience. You can't underestimate the resilience of children ever. They will really surprise you. So armed with the information, then you're able to sort of decide what's right to tap into and when is the right time for your child and for your family.
Oh, that's really good to hear that, Alex. And I think what is nice to hear is that this is nationally available.
Accessible. And our counsellors are remote as well. So, obviously with children, you usually want to go in person.
Yes.
But there is that support as well that you can access if you're in sort of further from Dublin. It's not Dublin centric.
That's really good.
Which is good to hear.
Yeah, thank you for that, Alex.